These are the instruments used for dilatation and curettage. First of all, this is bladder emptying cannula. There is a hole on this side which is inserted into the bladder, and this is the outflow side from which urine comes out. Next, uterine sound. You can see uterine sound. There are marks on the sound. You can use it to assess the size of the uterus. These are dilators of different sizes. This is the large size dilator, smaller size dilator, and more smaller sizes. You can see that the one side is shorter than the side, and the marks are written about the size of the dilator. Like here 5 is written, this is number 5, and this side is number 6. Like this, here it is dilator number 11 and 12. Here 11 is written and the other side is 12, so 12 is written here. These are dilators of different sizes. Next, this instrument, this is called tenaculum. You can see there are 3 to 4 tooth over this over the grasping edge, and this is called tenaculum. This is to hold the tissue during dilatation and curettage. We use it to hold the anterior of cervix. We can also use tenaculum to hold the anterior lip of cervix. Here you can see that there are sharp edges of this tenaculum, like appearance, sharp, and it is used to hold the anterior lip of cervix. This is sponge holding forceps. It is used to grasp the tissue, or you can use it to hold the anterior lip of cervix in a gravid uterus and to hold the retained process of conception. This is suction cannula. You can see 2 to 3 holes on this edge and the outflow part from which tubing is attached and the suction of the uterine cavity is done. This is also a suction cannula. This is Sim speculum. Sim speculum is used to detect the posterior vaginal wall of vagina and to visualize the cervix. This is duct speculum. This is usually not required in dilatation and curettage. This is used to examine the cervix, and we can also use it during insertion of copper T and many other procedures, but this is not used in DNC. So DNC instruments are Sim speculum to detect the posterior vaginal wall. These are suction cannula for suction of retained process of conception. This is sponge holding forceps, tenaculum with sharp tooth-like appearance, and it is used to hold the anterior lip of cervix to hold the tissue. This is tenaculum with 3 to 4 tooth. This is our curette. This is of large size curette and this is of a smaller size curette. We select depending upon the size of the internal os and the size of the uterus. And there is a sharp side and the other is blunt side. We first use the blunt side, and sharp side is required only in a few cases. This is used to curette the endometrial walls. Cervical dilators, they are required if you need to dilate the cervix. Uterine sound and bladder emptying cannula.